So here we're going to use an action potential machine to treat knee pain. So the most logical way to treat knee pain is to come in from below with the blacks to above with the reds for our second placement. So your first placement will be the spine, just like in the other videos. And then your second placement, the pain here is just under the kneecap. So we're going to have 2 blacks a couple of inches below the worst pain. We're going to bring this one a little bit in. And then we're going to have 2 reds a couple of inches above the worst pain. Like this. Then you're going to do the same as always. You're going to make sure that you are pointing to the 0. You're going to turn it to the on. You're going to turn it up gradually. And when you feel a tingle, tell me when you feel a tingle.
Yep.
Okay. You're going to turn it down by about 2/3. And then we're going to check that the person is not above their age-related maximum. So, are you between 40 and 60?
Yes.
So between 40 and 60, your age-related maximum is 0.40. So we're actually treating at 0.11 here. So that's absolutely fine. So this is going to run for 8 minutes and then turn itself off. I'm just turning it off now so that we can think about a different way to treat knee pain. So as well as going from below to above, we can also go side to side. Now when we are treating below to above, we normally use the black electrodes furthest away from the body and the red electrodes nearer to the centre of the body. And the reason for this is because you want to help push any products of inflammation more towards the centre of the body, which is where your main lymph nodes are, and that helps to remove waste products. So let's have a look at going side to side across the knee. So then we would just gently pull the electrodes off and we will start putting them side to side. I'm going to start, actually I'm not just going to directly transfer them, I'm going to put them back on the plastic so we can make a clear start. Okay, so let's go side to side. We can go, because it's a nice chunky knee, we can actually, where would you say, could you show me with your hands where the worst pain is? Right in there, okay. So we don't want to miss out that real worst pain area. So I'm going to make sure that one set of electrodes goes directly side to side so that the current can go straight through that pain area. And because it's a nice chunky knee, the shortest route for the electricity is directly through. So we've got black here, red here. And then we're just going to replicate that. Now, does it spread up this way at all or spread down that way at all? So it more comes upwards. Okay, so in that case, we're going to use the other set of electrodes just an inch or so above. So we're just replicating that pattern. And then exactly the same process, 8 minutes. And then your last placement is doing the palms of the hands and the soles of the feet. And in this case, because the problem is below the waist, we would have the blacks on the soles of the feet and the reds on the palms of the hands. So let's just see both sides. Go from this side to this side. Okay, lovely.